Imagine a world that engulfs you in darkness and filth, the only world you have ever known. You are caged, isolated, starved, and deprived of water. Imagine experiencing hundreds of procedures that burn you, make you go blind, and can even cause death. Envision witnessing these procedures performed on others like you and seeing countless of them die, leaving you to think that the next time is your time. Take a second and think about this scene in your head. Now come back and allow your hearts and minds to be changed by the facts about animal experiments. Animal experimentation is a leading strategy in both medical and cosmetic testing. This affects millions of animals worldwide, which is why it needs to be discussed today. To understand this, we're going to talk about why it's cruel and inhumane, why testing on them is a poor strategy, and the alternate methods that we can use. The practice of animal experimentation by companies and the lenience of the federal government is simply barbaric. The tests include forced inhalation, food and water deprivation, burning, drowning, and isolation and addiction to drugs. They even experiment on death, such as carbon dioxide, asphyxiation, neck breaking, and poison. One of the worst parts, the federal government does not require experimenters to give painkillers, and more times than not, they are not given to the animals. Here are two examples of some of the tests. This is a cosmetic test that for shampoo that they usually perform to try and get animals to see the eye irritation. And so what they do is they put drops into the animal's eye, hold it open, and then they let them sit like this for days. Here's another one, which is called LD50. It is where they inject a poison or some type of chemical or expose them in a way to a chemical that until 50% of the population in that study is dead to see the toxicity of that chemical. While the physical effects are pretty obvious, the psychological ones are not and have recently just begun to be explored. Animals in experiments are often held in isolation or are often put into cramped cages with far too many animals. They experience considerable suffering that causes them to have animal stress, and prolonged captivity can lead to abnormal behaviors such as self-harm and aggression. A 2011 study provided from Animal Psychology shows that this trauma that the animals go through are similar to PTSD and depression in humans. Here's a short video.
Burning, cave circling, screaming hurt. We shudder to even imagine.
All in the name of research.
Testing. 1,
2,
3. Does a rabbit wear mascara in the wild?
So now that we've seen how cruel and horrible it is, it's time to understand what a waste it is to make these animals go through this treatment. 95% of drugs fail in human trials that were successful in animal trials, despite having results that were supposed to guarantee passage through human trials. Out of 93 dangerous drug side effects, only 19% of them could have been predicted by animal testing. Globally, there are 115 million animals experimented on, and only 25 new approved drugs are approved by the FDA. It's also wasteful in our money and how we spend it. Research is 50 billion a year, with only 6% of 4,300 international companies registering a new drug. And what's worse, those drugs that get approved are not helping as many people as they should be. The top 10 drugs are helping between 1 in 4 people to 1 in 25 people. So it's not very effective. 10% of the treatment that was supposed to, for human trials that was supposed to, 10% of the experiments that went through animal treatment went to, for stroke treatments went through to human trials, and none of them were successful. Only 5% of treatments resulted, or 5% of experimentations on animals resulted in approved treatment in the last 20 years. Testing on animals is also dangerous, not just for them, but for us. A drug called Vioxx, which was tested on 6 species, including monkeys, which is our closest DNA relative, caused 320,000 heart attacks and 140,000 deaths. In the UK, one of their drugs caused a severe allergic reaction and caused the deaths, people almost nearly died. But it shouldn't have been that way, because when they were testing on the monkeys that they were testing on, but they were giving the dosage 500 times larger than what they gave to humans, and we still couldn't have predicted the effect that it had on us. In another study of a treatment for hepatitis B, there were 7 patients that were severely injured in liver damage, and 5 of them died. All of this can be attributed to the fact that animals are just different from us. Mouses and rats, which make up most of the population of animals that are experimented on, only share DNA with us up to 50%. And monkeys that share about 99% of DNA with us have very many different resistance to drugs like paracetamol that is lethal to humans. So some people say, well, it's the best that we have, it's all that we can do, but it's really not. There are many different options out there, and we have in vitro testing, microdosing, artificial human skin, microfluidic strips, and computer models. It's simply more cost effective. Out of an unscheduled DNA synthesis animal test, it's $32,000, whereas for a vitro alternative, it's only $11,000. For a rat phototoxicity test, it's $11,500, but for the non-animal equivalent, it's only $1,300. A rat uterotrophic assay is $29,600, but a vitro test is $7,200. And apart from saving us money, it's simply more accurate overall. According to Animals in Science, EpiSkin and QSAR models, computer models, detect 90 to 95% of possible skin irritation and skin damage results. Epiderm, which is like EpiSkin but just slightly different, can detect 100% of the effects, of the predicted effects of what humans were going to come out with, whereas when they tested it on rabbits, there's only 40%. There's also a replacement to the LD50, which I was talking about earlier, that said that they kill half of the research population. This instead is accurate comparatively 85%, whereas the LD50 is 61 to 65% in toxicity measures. There are also computer models that accurately predict drug effects. There's also human patient simulators. One of the main ones is the Trauma Man, which replicates breathing, bleeding, has similar tissues and bone structure, that would be much more effective for testing. And the fact that drug companies aren't saying this, but universities are, as 97% of universities have turned away from animal testing and gone to things like human patient simulators, according to animal testing. So today, we talked about why it's cruel and inhumane, why they are poor subjects, and how little accuracy we get from their trials, and also the alternative methods, the better ways we can better their lives as well as our lives and protect everyone in this situation. I want you to think about all the pets that you have in your life. Can you imagine them being subjected to drowning, cutting, having their skulls cut open without any painkillers? I want you to think about why these animals deserve more rights than the animals that we do not own. Why should we inflict more pain on animals that are not humans? Because humans are animals too. I want you to ask yourself, what gives us the entitlement to have such power over other animals' lives and their bodies? When you finally get around to asking that question, to answering that question, and seeing that nothing justifies this, there are 4 things you can do. You can refuse to buy you can always buy cruelty-free products. Always make sure to educate others. Make a donation to foundations that are against animal cruelty. And leave your body to science so that your body can replace other animals that might have been tested on. For a better world, go to www.peta.org. Thank you.